Welcome to my podcast. Today I'm going to talk another case. So basically, after you introduce yourself and double check the patient name and date of birth, you will ask the patient, how can I help you today? So the patient will tell you, I have received a letter for the annual review for the diabetes, for instance. Now let's take an example for diabetes. So you will ask the patient, how's things going on? How's everything? How's the last since I saw it the last time? So the patient might have certain concern, might raise them. Maybe the patient will say everything is okay. Patient maybe say I'm having a specific question that I would like to ask. So you will address the patient main query, and then you will ask them how's the wee, how's the poo. Is there any particular changes or anything that doesn't seem right, or maybe it's not as it was like before? You will ask about their thirst, if they excessively thirsty. And you will ask about if they can spot the sign and symptom of hypoglycemia, and ask them if they have any sugary thing or a small sweet they carry in their own pocket in cases of emergency. Also, you'll ask about what sort of medication they are taking. Is it insulin or oral hypoglycemic drugs? And if there is any issue with that, for instance, for the insulin, if they know how to inject, and if they notice any problem with that, and how they've been taught to deal with it. If they are type 2, so if they are taking any medication, so inquire about the name, the dose, how frequent they take them, is it regular, do they miss the dose certain times, and ask if they are checking their blood sugar regularly, and if they have any problem recently. And then you will ask certain specific questions, if they have any heart problem, if they have any problem with their sight, if they have problem with their kidney, if there is any numps and paresthesia and their legs, if they feel and the injury, if they check between their toes and on a regular basis, and also if they are able to see things clearly, and if they have any issue with their wheeze as well. And then you will check if they have any recent blood test been done, like hemoglobin A1C, any blood sugar, if they did with their machine glucometer at home, check their blood pressure, check, do eye screening, and also check for cholesterol level, and examine their feet, their legs for any injury or any marks. Advice about their diet, so inquire what sort of food they are eating, if they are eating healthy food or they are not eating healthy food. So you might direct them and tell them there is a dietitian that you can refer them to in order to help them with the diet they should take in order to keep healthy. Also inquire about their height and weight, and check their body mass index. So if they are, for instance, within the normal expected weight, or if they are overweight, or if they are excessively obese, so you will inform them about that, and help them how to the healthy way how to lose weight, and if they needed any emotional, psychological support, if it's recently diagnosed, they might be shocked, maybe they are feeling withdrawn or any of that. Ask them if they know how to, direct them if there is any need for diabetes education course. So you will give them a leaflet, you give them some information leaflet in order to read. And you can also send them for a diabetic specialist who are dealing with diabetes mostly. And usually those cases are seen by the practice nurse, unless there is a need for the GP. If there is anything that seems complicated, so in that condition, the GP will intervene and treat the case and manage it accordingly. Offer them the free flu jab, and also inquire if there is any plan for conception for instance. So you will tell them that they might need a specialist care. And also, if they are driving, you will ask if they are taking insulin or their drugs, and if they have any sign symptom of hypoglycemia or fainting, and that they need to have a small sugar eating on them in order, to relieve that. But of course, if it's more than once, then here their driving might be affected by the DVLA. And also, advice about the portion meal, and inform about avoiding late night meal, which could affect, them. And if they need, for instance, ophthalmological examination, screening for their sight, you will do that, of course, with a referral. And if there is any patient, if they have any specific concern, they raise it, and you need to address them and explain to them accordingly. Certain patients, they might have issue when there's a sexual act, so you will inquire also about that, and you will manage accordingly, and if there is any need for a referral. Advice also about lifestyle changes, that they need to go for a brisk walking, and try to lose the extra weight, and try to eat always healthy food in order to keep a healthy weight. So by that, I hope that I covered the main points about the annual diabetes review, and I see you on another podcast. Thank you.